Good morning. My name is René Laennec. I was a French physician and musician. I was born on 17 February 1781 in Quimper, France. When I was 5 years old, my mother died of tuberculosis, and I moved in with my uncle, who was a priest. As a child I suffered from lassitude and pyrexia on a regular basis. I was also suspected of suffering from asthma. I moved to Nantes at the age of 12, where my uncle worked in the College of Medicine. I was an exceptional student there. Doctors used to listen to their patients' heartbeats by putting their ear to their chests before the stethoscope was introduced, which was an inefficient procedure. For example, if there was a significant amount of fat between his actual heart and the exterior of his chest, this procedure would fail. I had a similar dilemma when I couldn't adequately evaluate one of my patients' heart rates due to the patient's excessive weight. I devised the stethoscope, a trumpet-shaped wooden tube that magnified sounds from the heart and lungs. While working at the Necker Hospital in 1816, I used my talent at carving wooden flutes to design the stethoscope. I was the first to use it to diagnose various chest ailments. In 1822, I was appointed as a lecturer at the Collège de France, and in 1823, I was appointed as a professor of medicine. My latter jobs were as the head of the medical clinic at the Charity Hospital and a professor at the College of France. I took lengthy walks in the country, danced, read Greek, and wrote poetry after my father, who was a lawyer, discouraged me from continuing my career as a doctor. In 1799, however, I returned to my studies. I studied medicine at the University of Paris, under among well-known doctors. I was taught how to use sound as a diagnostic tool there. I had discovered that the new stethoscope was superior to the normally used method of placing the ear over the chest, particularly if the patient was overweight. A stethoscope also avoided the embarrassment of placing the ear against the chest of a woman. Using my understanding of typical and unusual chest sounds, I was able to more clearly diagnose pulmonary phthisis. I was the first to classify and describe the phrases rales, rhonchi, crepitance, and egophony, which doctors currently use in physical exams and diagnosis on a daily basis. The French Academy of Sciences received my findings and research on the stethoscope, and I published my masterpiece on mediate auscultation in 1819. I referred to the stethoscope as the cylinder, and handed my own stethoscope to my nephew as the greatest legacy of my life. As I approached death only a few years later, I died of TB at the age of 45 on 13 of August 1826. If you want to know more about me, please Google me. I love you people.